Right, welcome. Today what we're going to look at is a gluteal tendinopathy. So we're looking at the lateral hip, we're looking at glute med. So I just want to explain where you're going to get and what sort of symptoms you're going to get associated with this. So actually if you feel, so on Rihanna here, if we get onto the lateral hip, you can feel the bony point. And if you go just up from that, you're going to hit that tendon where that glute med muscle is going to be tender and sore to touch and to press on. Okay, and then the muscle runs up through underneath the big glute muscles, it runs up to the top of the pelvis. So you should be able to feel through there. The muscle might be a bit tender, but your major point will be just above the bony point of your hip. What you'll tend to find with this, it'll feel stiff in the morning, it'll feel sore. You'll find if you start walking, it'll feel easier, you move around, but then if you sit down or stop, it'll start to feel stiff again. You feel like you have to get it moving. Once you get it moving, it'll feel okay again. That's normal tendinopathy problems to have. It'll be a dull ache that will sit in around that area. It'll be quite sharp if you push directly on it. People tend to find actually sleeping on that side at night can sometimes be painful. We've got to remember differential diagnosis, potentially a bursa, which sits just below, so more over the bony point, can also be painful and tender. So make sure you get the right diagnosis and therefore you're doing the right exercises. If it is a bursa, you might need to calm that down first before you start the retraining strategy. So that's what we're going to look at. We're going to find 3 really good exercises for you to start to settle down the pain. But remember, this is phase 1. Resolving tendinopathy problems really takes 3 or 4 steps to get you to the best place that you can be.
Cool.
Okay, right, so we've got Rihanna with us, and I'm just going to go through the 3 exercises I think are a really good place to start. So we're looking at phase 1, we're looking at calming your pain down and helping get things going. So we want to build some tissue tolerance up through both the muscle and the tendon to try and help get tolerance back in that so we can improve the capacity through the leg. So I've got Rihanna, we've got her feet nice and straight. Knees are going to stay straight, facing ahead, so I don't want your knees to come in over your toes. So if Rihanna just does one for me, so as she bends forward, I don't want the knees to go that way. We want the knees to stay out. We've got the band to add a little bit of extra resistance and loading through the hip. And you're going to come down into that position and you're just going to hold. It's a small knee bend, it's not a squat. You're not trying to sit down on the chair. It's a small knee bend. Your hip should stay above your heel. Your knee comes forwards. You're going to hold the band and you should feel the work. So if you're coming onto the hip bone, just above the hip bone is where the tendinopathy will be sitting. So that's where your pain will be. And you're just going to load through that area all the way up to the muscle. You're going to hold it for 10 seconds and you're going to come back up slowly and then go back down and hold, and you're going to hold it for 10 seconds again. What we're going to do is going to increase the workload. So you're going to start with 10 seconds, build to 20, build to 30, and eventually hopefully we can get you up to hold to about 60 seconds and you'll work on doing 3 of those. Okay, so we're building that capacity as you feel you can. The idea of being static, it won't irritate the pain. You can load the muscle and the tendon without irritating your pain levels. If you come back up, I'm just going to get Rihanna to turn around and face me, just so you can see that small knee bend, so she can correct her back position, and you can see the hips stay above the feet, knees come forwards, and we hold the band, hold the position, and then we come back up. Okay? 10 for 10 seconds. As you feel comfortable, increase the time to aim to get towards 3 times 60 seconds. Okay, so what we've done, the first one is we've worked double legs, so we're loading nice and evenly. What we want to do as we progress is to move to single legs. So we're going to go through 3 phases here and you progress as you feel comfortable. That's the idea. So we're in a sort of short lunge. The toe at the back is on the tip of the toes, not on the foot. And we're going to go down into a single leg, small knee bend, and we're just going to hold there, making sure that knee doesn't come across the midline, it stays out. Your weight stays through the heel, so you should find 80–90% of your weight is on that front leg through the heel, and again, you'll feel like you're loading that hip. We're going to look at holds. If you've done phase 1 and you're going to this one, you'll want to start short and build up. Again, the same sort of thing. We want to get to 3 times 60 seconds of work. And then we're going to come up. Now, I want to try and increase the load, so we're going to actually take the toe off. So we're going to come onto a single leg, and then we're going to go to the same position. Again, so we're adding rotational challenge to this. We're targeting single legs, so we're adding more load into the system. as we're going through. Again, same thing. Now, it's not a balance challenge, so if you need something to balance, you can use back of a chair or a table just to tap to keep your balance, because that's not what we're trying to do. We're trying to make sure that we're loading the muscle on the tendon correctly. And then if I get Rihanna to pop the band, so the same band we used earlier, just going to grab a hold. And again, as I said, it's not a balance challenge, so I don't want you gripping it, I just want you lightly touching the top. Okay? So we're now going to come back into that single leg, keep the knees apart, hold and lift that back foot off if you can, and use that for support. Fantastic. So now we're adding on a bit of resistance, we're still loading, we're targeting that area. You're going to find that that really starts to fatigue through as working. We want that, we need that fatigue in the muscle to really help, one, the tendon to repair and recover, and two, to get the muscle stronger to help hold the whole system. Okay, so the next one that I do, and I do all three of these exercises together. You'll find the single leg one, you'll probably want to do some work on this and the double leg first before you progress to that, but you can do all three of them at the same time. We want to keep loading and building up the muscle work and loading around the tendon to help you progress. So what we're doing here is we're lying on our side, head down, so you can keep your waist lifted. We don't want to collapse here. We're not coming up very high, but we're going to bring the leg back into a little bit of extension. We want the ankle just above hip height, so just a little bit higher than that. That's it. So we're not coming up super high, not as high as we can. We can get up to there, so about halfway. And then holding that, we're going to keep the leg back. So Rihanna's using my leg just to keep that little engagement. And then we're just going to rotate the knee just a little bit, just to help target that, and then we're going to hold. Now this is going to be hard work. Start with 30 seconds, build to 60 seconds, try and get 2 or 3 sets of this, but it's really going to fatigue. You're going to find your leg wants to drop. So you've got to really work and concentrate to make sure you're engaging through that muscle. But this is a great one to do for loading the area and making sure that we get you out of pain with your hip tendinopathy. And rest.